Is bilateral knee replacement surgery at the same time the right choice for you? Hey, I'm Dr. Patrick Figueiredo here at Physical Therapy Balance Centers in Harker Heights. And I had a patient walking in the clinic today asking about knee replacements and what physical therapy can do to help, and she's considering to perform both of them at the same time. So decided to make a video, and hopefully that can help you as much as it helped her. So a couple things for us to consider, right? So when is it a good thing? When do you feel can be good for you? So one of the big things is the decreased risk for infection. Any surgical procedure, there is that risk. So you are decreasing it in half instead of having 2 surgeries just in one. That might be a benefit that you may be looking for. Another one is the overall time it takes for you to get better, because both knee replacements just may take as quickly as it does for each knee. So that recovery, instead of being a few months for one and then taking a break and doing the other another few weeks to a few months on the second one, so you putting all of that together in one. So depending on the activities, that might be something that you may consider as well. Okay, another thing is the overall cost that may come with it, right? It's just one copay, it's one hospital stay, it's one arrangements of vacation, days off, sick days that you may have to take, instead of having to organize that in 2 separate times of the year. So those are some of the things that will be helpful to see if you're able and if you qualify to be able to do both knees at the same time. On the other hand, there are some cons that we should consider, right? It's a very demanding surgery, right? It requires a lot of things, and it's a big major surgery. So you need to make sure that you qualify, you're healthy enough to talk to your doctor, talk to your physicians to see if that's something that's a real option for you, or if you really need to be best off going one at the same time. So not everyone is a candidate for doing both knees together, right? Another drawback is you may never know that if you actually needed that second knee surgery. A lot of the times we've seen here during rehab is once one knee gets better and you're taking the pressure off of it, the other knee could have done amazing job on getting a lot better and not actually needing surgery, or even delaying for years to come. So that is a chance that you may not be taking by doing it at the same time. You may never know if just one was enough or if you really need for both of them at the same time. Okay, and then lastly, the recovery process is overwhelming for some, right? So managing your pain, the mobility, your daily activities, you may be restricted a little bit on what things to do, and the healing is a challenge. It's a rough rehab. A lot of the times, a lot of people get great results, but there are some challenges that come with it, some swelling, some pain, and how it may impact your social life. So all of those you have to consider to see, am I ready? One knee might be doing great, the other one might be a little bit behind. So you need to be prepared, not only physically but mentally, for all of those little consequences that may happen in your day-to-day as well. So those are the ones that are the pros and the cons that I feel I was able to give her a few options. I hope that this has been helpful for you as well. If you have any other questions, please let me know. I'll be happy to make some videos for you as well. And I see you on the next video.